Hi everyone, my name is Dr. Afshari, and today I'm going to be reviewing the Prosomnus Mandibular Advancement Device, how to use it, steps of use, how to care for it, and use it to help better your sleeping. Hi Patrick, thank you for joining me today. Today we're going to be delivering your device. So before we begin, I wanted to kind of go over the anatomy of your tongue and kind of what we are doing with the device so you have a better understanding of what's happening while you're wearing it. As you can see, the human tongue is quite large. It's attached to the floor of our mouth and it's quite a large muscle. When you're laying flat, it can go ahead and block our airway and close up the airway, causing snoring and breathing issues and disturbing the quality of your sleep. What this device does is simple. It attaches to your upper and lower teeth and it moves the jaw forward. And when it moves that jaw forward, it also moves the tongue forward and thereby opens your airway so you get better ability to breathe at night. Before you get started, what I'd like for you to do is to make sure you brush and floss your teeth, just your normal nighttime routine. And right before you're about to go to sleep, what I'd like for you to do is grab your arches. You will have an upper arch and a lower arch. I want you to rinse them under water and make sure they're nice and wet because that's going to lubricate them. When you put them in, they're going to feel quite snug, okay? And what you want to do is first put your top arch in, position it over your teeth, and snap it on. Sometimes it might make a snap noise and sometimes it won't. But what you want to do is just kind of press firmly and make sure that it's seated. Once the top arch is in, you can proceed with the bottom arch. Put that in, snap it on, move your jaw slightly forward, and go ahead and close down and relax. And that's it. Now you're wearing your Prosomnus device. And you'll wear the arches that you and I have calibrated ahead of time. Once you're wearing this, you wear it throughout the night. It does fit snug, so it should not come out. Occasionally it might fall out and you can put it back in, but it shouldn't. That rarely happens. Also, because it's so snug, if you have a loose filling or a loose crown, it's gonna find it. So it can be a matter of time, but it will find it if it's loose. In the morning when you wake up, what you want to do is carefully position 2 fingers underneath the lower device in the front, and you want to push straight up and it pops right out. And the same thing here. You want to push right in the front, 2 fingers, boom, top arch will pop right out. Now, in order to clean it, you want to get some mild either dish soap or hand soap. That's all you need, and some lukewarm water in your toothbrush. And you want to clean it. Make sure you get all those, just the spit and saliva from the night off. And you want to clean it with that soapy water and put it in your case and let it air dry. Now be aware, animals love to chew this, so keep this away from any kind of pets that you might have. You can even close the lid because it is vented. Just let it air dry. Do not use any type of super hot water, bleach, or any kind of denture cleaner or toothpaste on the device because that will etch the device and you won't have a nice clean device for very long if you do that. So in the morning when you wake up, you may feel that your teeth aren't hitting the way they used to. And that's pretty common because your muscles have been moved forward all night and they may be locked in a forward position. So you might feel that your bite is off. What I have for you is a mandibular repositioning device. This will kind of remind your muscles where normal is. So what you want to do is gently put this on your bottom arch and slowly close your top teeth into the grooves. And then just keep it there for 15 to 20 minutes. It'll reset the muscle that way and you should feel comfortable right after that. I oftentimes recommend, if you're having a hard time, to take a hot shower with this in place, and that'll further help relax the muscles. And then when you take this out, you want to make sure you're closed down and your bite feels normal. And this is important. If you skip this step, you might have tooth movement. So I really want you to be adamant about doing this every morning so that you can ensure that everything is right back into place and you don't have tooth movement. For further instructions, you will have your Prosomnus instruction manual, and there is a QR code that you can scan with your phone and get more details on any other questions that you might have. But that is it. The Prosomnus device is simple to use and ought to be a pretty easy part of your day and help you get better sleep.